You ever had a dude try to get a BBL?
You tried to do?
No, I said, have you ever had a dude trying to come get a BBL?
Very frequently.
Very frequently.
Very
real?
frequently.
Absolutely. Very
Like-
frequently. Absolutely. Yes, we cater
Nah.
to them as well. Yes,
We can do
the trans,
consult
the
right now.
transgender.
Have,
Nah,
so
man,
have
I don't
you,
want
have you
that.
hold on. So you guys have actually performed a butt procedure thing on a man?
Absolutely.
Oh,
Yep.
not one,
Liposuction,
many,
fat
multiple.
transfer. Yes, and they're some of the most beautiful bodies on a man. Absolutely.
And you have to understand,
Fuck
it's
outta
it's
here.
it's about again, but
You're listening to Big Facts with Big Bank and DJ Scream.
Live from First Class Sounds, it's the voice of DJ Scream. Big Bank is here, Baby Jade is here. It's time for another
Hi.
edition of Big Facts, and this is a special Big Facts because we talk about this all the time. We talk about like body alterations and plastic surgery, and today we have not one of the best, but the best in the game, in the building, goes plastic surgery.
Shout
It's
out
in
to
the
Dr.
building.
B.
wow,
You know what I'm saying?
Thank you having me,
Shout out
guys.
to Nicole.
Goes. Yep, absolutely. What's up, everybody? First off, how's everybody feeling? Everybody's good. We got to do a vibe check on Big Facts. Everybody's feeling well.
Everybody okay?
Exceptional.
Yeah. Okay. So I'm gonna kind of jump straight into it. Me and my wife and me and some of my family members talk about plastic surgery a lot, and there's a lot of things that go along with plastic surgery that make me a little bit uneasy, such as some people don't come back with the same health as before plastic surgery. Some people actually pass away, and there's a lot of, I guess you could say, like side effects and things that can happen. So for a person that's uneasy about plastic surgery or has a preconceived notion that
Or
it might
limited
not
knowledge.
be a bad thing, might be a bad thing, I guess what's the first thing you would say to someone like that?
Well, it's obviously a surgical world, but we don't look at it like that. We look at it as a beauty world, body transformation world. Our motto is completely different. We're trying to bring an accent more on a body image and self-esteem, and that's what we bring to the table. As per surgical world, yes, it is a surgical world, and there are surgical procedures seriously done. So we look at it from also a serious perspective, obviously, and treat them as such. But for our customers, we'd like to present it as a self-esteem procedure, as a body image. We try to create goals as a basically like a lounge, a cosmetic aesthetic lounge. That's what we're trying to bring there.
So basically, like when you're saying that it's like a body transformation palace, and you guys really try to maintain your procedures, is it a situation where you try to like change the person's body, or do you kind of try to like keep what they have and just accentuate it?
Well, basically, everybody born with already preset baseline. I mean, when you're born, you have a certain body type, you have a certain, I would say,
frame,
body
basically.
personality. I would say,
Yeah.
which made out of bones and other tissues, not just fat. So, what we're trying to do is to find the best approach to that particular body, and to refine that image of the body has already. Since everybody is different and everybody's body is different, structure is different. I'm not even talking about into ethnicity right now, but every individual body has its differences. So with each procedure being carefully tailored to that particular body image,
Okay.
and we're trying to improve actually what the patient already have. I've been telling my patient all the way. I mean, you're born beautiful. I mean, whatever God created beautiful. You cannot argue that fact.
That's a
What
very
we're tr-
diplomatic
Yes.
answer.
What we're trying to do is just to improve your personal view of it.
Right.
How long you been doing this?
Oh, I've been doing it for 15 years already.
So when did the market just start booming for BBLs? Like,
I would say about 5-6 years ago, the marketing started booming for the BBLs, and it's been a good trend since then. And people coming more and more asking for that procedure. So about 5 years.
what's the
It's
biggest
been
city? What you think the biggest city is?
Biggest what?
The city. I'm saying, what city you think
Oh, the city.
make the most money off of surgery?
I would say probably New York. But Atlanta is new and coming and running already and operational. We do plenty of procedures in Atlanta.
You guys have practices in New York, correct?
Yeah, we have 3 medical or surgical units in New York and in New Jersey.
And
So
then
we have one in Bronx, we have one in Harlem, we have one in New Jersey, in Richfield. So we have already 3 surgical units, and it's actually originated and started in.
wow, but like typically, like speaking of New York, like you used to only hear about like the surgeries and the things like that, like on like uptown, like on the richer parts of what I'm saying, New York. So
I
what
know
made
what you
you
mean.
guys want to
And that's
be stationed
from day
in
one
the hood,
when,
for lack of a
absolutely.
better way to put it?
Absolutely, and from day one we started to bring affordable procedure to the public, and that's what our motto been from the day one, and we're staying by that even right now, and exactly that's why we started. We were the first one to actually move the plastic surgery facility in Harlem, and then later
really?
to Bronx. Yes, we opened in Harlem about 4 years ago, and since then we've been running that successfully that practice in there. And I'm very happy about that location. In fact, we right now have already 2 and a third location coming in Harlem.
Okay.
So what's the most popular surgery?
The most popular surgery, 95% of our procedures is liposuctions and BBLs, and we do it as a flex scalp, and this is the procedure created by Goals for the past 5-6 years of developing, and a flex scalp is a new procedure that we're introducing.
What's that?
The flex scalp is a unique procedure and technique that used to remove basically 85 to 90% of your body fat of the areas that have been used for the procedure in one session. You just need one session for this.
And how does the flex sculpt procedure differentiate from traditional liposuction?
From traditional liposuction, differentiate in a matter of starting with anesthesia. Anesthesia is local. That means patient is awake during procedure. So patient is 100% awake, talking to the doctors, see who's doing his surgery actually in front of him. We put music. We try to make it a little bit non-surgical way of doing it. We put the music in the room. We have TV in every room. We ask people what they want to listen to, which music. They talk to the doctor. They listen to the music, and the procedure becomes literally bliss. It's just like 2 hours, and it's all done.
Do most people prefer to stay woke?
We prefer them to stay awake for the reason of the flex scalp procedure, because in traditional anesthesia and traditional liposuction and traditional surgery, it is general anesthesia. And the humongous differences between the two.
What are the differences?
Under general anesthesia, you basically get intubated, your body gets paralyzed temporarily and flaccid. And technically speaking, you don't even know who is doing the procedure behind this.
So general anesthesia is when you go all the way under and you're completely out of
absolutely
it.
Out.
Okay.
And you require lots of medication going inside your body. Recovery becomes much longer. Our patient go home in 40 minutes, literally walking off the table, and we check their vital signs, make sure they're okay, and that's it. They leave the office.
And that's with the local anesthesia
recovery,
that allows
recovery
them to stay
time also is huge difference, because with the local anesthesia, it's 1-2 days, and you're back and up and running and doing up to your business. You have a little bit of soreness, but nothing more like that. In the general anesthesia, you have to recover all this bunch of medications that been placed during anesthesia, and it produces vomiting, it produces headaches, it produces all kind of uncomfort, way longer, about weeks after procedure.
You ever had a dude try to get a BBL?
You tried to do?
No, I said, have you ever had a dude trying to come get a BBL?
Very frequently.
Very frequently.
Very
real?
frequently.
Absolutely. Very
Like-
frequently. Absolutely. Yes, we cater
Nah.
to them as well. Yes,
We can
the
do consult
the
right now.
transgender.
Have,
Nah,
so
man,
have
I don't want
have you
that.
hold on. So you guys have actually performed a butt procedure thing on a man?
Absolutely.
Oh,
Yep.
not one,
Liposuction,
many,
fat
multiple.
transfer. Yes, and there's some of the most beautiful bodies on a man. Absolutely.
And you have to understand,
Fuck outta
it's body again. We're coming back again to the body image. I mean, men, like I've been saying, also humans. So they also
But
come
why-
to do
I'm
the
saying,
same procedure.
So they putting the fat in their ass?
Yes, literally,
don't.
quite literally. We
I'm
we
sorry.
take it from the body, and we right away transfer it back into to the designated area, I would say, and that area become plump and nice.
Some men also come in for ab etching, just lipo. Say if they have love handles in
Oh, they
different
be wanting
areas they're
six-packs
not
and
able
shit.
to
We
address.
see-
Yes, we do ab etching as well.
We
so
seeing more of that in the hip hop
In the
culture.
hip-hop community.
Yeah, people
What?
getting certain.
Like
some people.
lipo and six
moving
packs
this-
and
Yeah.
stuff like that. It's a lot of rappers doing it.
So let me ask
I don't
you,
believe
so people will know. A lot of times people want to take shortcuts and save money and so forth, right? So explain to them the importance of coming to an establishment like Goals, as opposed to just taking a flight to a small country, Dominican,
third world country,
a third world
like-
country
like I
to
said,
regulated.
we make it as the number one is that we're making it affordable to almost everybody.
Got you.
That's the most important part. That's why we're so successful in that respect. Another thing is we have a unique way of doing the procedure, and the flex scalp is a unique procedure that again been developed for years. It's from one perspective it's for the comfort of the patient, and from another is for quality of the result. The quality result is very important to us because we started from that. I mean, we've been talking about body dysmorphic disorder or body image of the patient, and ultimately it leads to self-esteem. So all these procedures and technique are going forward that way, in that channel, to change the body image of the person. So the procedure is designed in that way that it's very easily tolerable by the patient. Literally a couple of hours, that's all it takes, and we try to make it as comfortable, and the doctor has been accommodating during procedure. So it uses specialized cannula, and it uses power assist, even with administering fat. When I started in this country doing a BBLs, we've been using injection with a syringe. And it took me about 45 minutes to an hour of hard work, piece by piece, to add that precious fat to the body. Right now, the procedure, obviously, 45 minutes for the patients too. So right now, the procedure literally, of the BBL part, takes literally 15, 20 minutes with our technique. And it's well tolerated by the patient. Patients don't even know. We usually even tell them, hey, honey, this is just anesthesia coming. And they kind of prepare themselves for something that's extraordinary going to happen right now. But nothing happens. And before you know it, the procedure is finished. We're right away showing the results to the patient. We're making pictures, videos, and show to the patients, which many times result in some tearing, and because the body image really transformed in front of your eyes.
So let me ask you
Immediately.
this: what is a double BBL like? Do you get like a double booty, or like what the hell is that?
Double booty.
Yeah.
That's new. We have to work on that. no, there's still a one booty. It's still one booty, but the point is we're adding way more area and position fat in such a way that we include the outer thigh area, because you have to remember.
Also, to
it's-
basically make the legs match.
In our world, it's all about magic S-curve. The S-curve
Right.
goes from the sides, and S-curve from going from your back area. So in different way you position the body, you want to see that pronounced S-curve. That's the whole point of it. The double BBL really enhances the result of a regular BBL by adding fat on a certain different area to support the butt, to lift it more, to make I would say lateral, which is basically outer thigh and going to mid-thigh areas, to enhance S-curve all around the butt. That's what the double BBL is.
Also, double BBL just meaning we're transferring to the butt and the hips. And so usually a BBL just is meaning transfer to the butt. And so when we say a double BBL, we're doing the butt and the hips as well.
At the same time, basically.
Yep.
So it's not like a booty and a half.
Mm-mm,
shit
no,
like that.
yeah.
Okay.
Y'all just creating
Not-
curves.
Yeah,
Absolutely.
Creating the curve.
Yep.
So what you think, in your opinion, when you from your patient, before and after, when you do a person, and after you do a person, what you think changed within that person?
Well, you will see if we do the before and afters, and we'll show the before and afters, you will see basically tremendous, and I'm not joking, it's tremendous transformation. You have the area that's called love handles, and that's what you've been asking. Most of us suffer from that. I mean, we have love handles, obviously cosmetically suffer, and those love handles is a very unwanted areas for almost everybody. That's a flank fat. By removing the flank fat and at the same time transferring below in the butt and in the hip area, it's completely transformed upside down the S-curve, because the S-curve before was actually a flank, and the butt actually started way higher. So what we want to put the butt image on the correct position, at the same time enhance the torso areas. So when you look at it from behind or from the side perspective, you will see a dramatic change in the curve.
Well, I'm saying, what you think it do for their like mental, like confidence and shit? Can you see the difference, like in the patient from when you met them?
Many times I've been doing this for years, and many times I see those people many times crying on a table when seeing the results, because technically it's a dramatic transformation for most of them, and right on the table they can appreciate what just happened. They never saw this before, and they know their body very well.
Yeah.
So it's immediate, gratification for the patient.
So I have like a two-part question, kind of like a before and after surgery. I have a couple of those, but my first one is before people get these surgeries and these procedures done, is it necessary to get like blood work and or a medical clearance?
Oh, absolutely. I mean, we are very strict with those terms because the patient come to the office wanted the BBL done, wanted the body transformation, and we want to make sure the procedure is safe for them. So
Right.
it's a strict protocol in our office. Every patient that getting any procedure at our office at Goals require medical clearance from their doctor and laboratory work. Only after our review, me, myself, and we have other doctors working for us, reviewing all these results, the patient only can get a medical clearance from us also as a second stage to get for the procedure.
So it's like a two-step verification.
It's kind of two-step verification because
Okay.
they're doctors. Many times the doctors send us clearance, but we don't accept it too. So
Okay.
it's not only about those doctors; it's all also from our perspective because we know our procedure well, and many times we're not doing the procedure for the person for the medical reasons. Yes.
Okay, cool. And then after you get certain procedures done, I know like I've seen like I have friends of mine that have gotten like like the butt thing and the liposuction and all that kind of stuff. What are those garments called that you have to wear?
They call the faja or compression garments. It's
Okay.
a extreme necessity to put it right after the procedure compression, because like I tell patients, when we liposuction the area under the skin, that become empty territory. We liposuction like 85%, 90% of fat out. So between the skin and the muscle, literally there is kind of nothing. But we all know that empty is never empty. Okay, so the magic liquid, which called edema or swelling, will start
Right.
substituting in those areas of the tissues that were removed. So what's going to happen? That's too much liquid starts accumulating. That is a magic liquid. It promotes healing. The body doesn't do some of these things. The body is promoting the healing after our
Right.
what we did. So we need that. However, the amount of liquid should be minimized, and that's what the faja and compression garment for. That's why we do.
It's
In
called a
our office,
faja.
yeah, in our
Okay.
office, it's called a faja or compression garment, as you can say it. So it's meant to compress those areas to desired shape from one perspective, to minimize that liquid inside
Okay.
to the minimum, and to decrease that the area that we've been working on. The patient must wear the faja about 5-6 months, and they go through stages. And this faja should be for the most part of the day we worn there, and that will ultimately result much better quality of the procedure.
Who are some of the like notable names that of people you've worked on? I don't know if there's like reality stars, athletes, rappers, or anything. Anybody?
Or is that
Anybody?
something that you
Yeah,
guys can discuss or?
This is a HIPAA,
HIPAA.
Okay.
kind of.
Okay.
I can bring multiple.
Okay.
And people on our Instagram knows about all of them because they all
Right.
become brand ambassadors or influencer, and we presenting the work to them and during procedures.
Right.
However, without it, we have a HIPAA violation law here, so I
Gotcha.
cannot kind of.
Okay.
But
Gotcha.
we
And
did
what's
many.
tell everybody what's the Instagram so that they can go and talk about it.
So our Instagram is Ghost Plastic Surgery at Ghost Plastic Surgery, and you can always visit us on Instagram, and we're glad to accept you as a follower.
What's your background though? What made you want to be this type of surgeon?
Well, that's a long story, but to make it short, I always loved the cosmetic world. It was my motto during my years when I graduated from medical school. I wanted. I've become an emergency room physician and spent there 8 years in Elmhurst Hospital. You saw it all on TV. During COVID times, it's been on New York TV every day. It's one of the busiest hospitals in New York. I spent there 8 years working as an emergency room physician, but my inspiration and always wanted to work in a cosmetic field. And I started slowly but surely working in a cosmetics field. I've been doing all kind of fine injectables and transforming patients' faces, and we start doing even at one point a laser liposuction. And from that moment, it was just I just found myself right there, because now I could transform not just the faces and become basically a total body transformation. I can do faces, I can do and the patients basically appreciate that, and we do it all in one place under one roof.
Is that where the most money at though? In
You know, the
cosmetics?
money right now, I don't know where's the most money right now.
I'm
But,
saying in
but
certain-
certainly cosmetics produce some
It's a booming business. Yeah.
I'm saying
These
out of
are
all
really
out of all the
business-
like
it's-
surgeons.
All different types of surgeries. Yeah.
Yeah, all different types, and we do plenty of surgeries. We do, besides the liposuction, we do breast implants, we do tummy tucks, we do full array of plastic surgery procedures and cosmetic procedures.
Aesthetics,
And you
lip
got
fillers.
offer, yeah, that's what I was about to say. You guys offer
Yeah.
a lot of aesthetic procedures,
Yeah,
correct?
chemical peels, which is the Voskin peel, wood therapy. We have M-Sculpt.
Hair
that?
sculpt with us, laser hair removal.
You guys do the vagina tightening too,
Votiva.
right?
Yeah, we
Yes.
do Vativa, we do vagina tightening. Yes.
Oh, okay.
What,
Screen.
you gotta go
I
inside.
got-
Why you what?
You
Hey,
gotta
look
go
at
inside.
say
Look how you-
screen for.
How you tighten them up?
Don't ask for before and afters, please.
How do you tighten them up? How you tighten them up?
Well,
What's the process?
it's a special radio frequency device that produce amount of energy that basically tightens up the inner wall of the vagina after several sessions of the procedure. That's
Yeah,
what
because
basically-
they going to get their body done and they're still loose as hell.
Bleaching, intimate
So
bleaching.
do y'all push that? Y'all should push that off on them. Like, you should get your shit tightened too.
It should be a
That should be a
combo.
package deal.
Loosey tighty, right?
There's an idea.
So are there any
Someone's loose and someone's tight.
are there any like procedure like that or other ones? Are there any potential side effects or people anything that any shit that people should be aware of? Like, hey, if you
Oh,
do
of
this,
course,
this
and,
could happen.
Our audience probably been reading a lot on the market. There are a lot of Instagram on internet. It is a surgical vault at the end. I mean, yes, it is a beauty procedure, but we have to treat it seriously. It is a surgical, and that's in our case. It's one of the beauty of the flex sculpt because procedure done under local anesthesia. I'm going to just give you a quick example. Under general anesthesia, body become completely flaccid, meaning there is no response from the patient whatsoever. Once the patient has become unresponsive, and that's the intent of anesthesia actually, all the body tissues become flat and the muscles are not responding. So in our world, the muscles are all there. So for us, puncture somebody or to do certain bad things to the body, it's almost impossible because we always have a feedback on the patient side. Because patient is awake. So if I'll go to a wrong area, patient will definitely tell me that. Right? And that's a beauty of local of anesthesia, and that's the beauty of the flex sculpt.
And I got a better understanding of it actually because I was able to visit the facility and actually like see one of the procedures getting done because I've always been like curious about it and like wanted to know because I have lots of friends that have done like several things or whatever, but I just never knew the specifics of it. And we'll get to that, like what I saw and all of that stuff. But it was extremely interesting. It was very interesting.
I do want to add that the patients are completely relaxed, though. So we do give a combination of medications as well as nitrous, and so the patients
Absolutely.
on top of the local anesthesia. So if you think
Nitrous
about
is like laughing gas, right?
yes,
Like
exactly.
laughing gas, and
Yeah.
sometimes the procedure actually become a little bit funny because
They,
it's
yes,
laughing
patients
gas.
will be laughing.
Yeah, the patient's actually
Absolutely.
laughing, and I've been saying you laugh your way
Yes.
through the procedure. You know, that's
Yeah.
What's the best ways like for the scars? Like, you know,
we don't really have scars. This is not a liposuction, if we're talking about it, is not really surgery. It's a surgical procedure, and we do like 4-5 millimeter holes in the body. That's
So
all
it's
we do.
minimally
Very small
invasive.
It's
incisions.
minimally invasive.
tummy tucks. What about
And
tummy
of
tucks?
cour- well,
Tummy
tummy
tuck,
tuck is
yeah,
a
scars.
wide, big cut that's supposed to be done for every patient entering the tummy tuck because you have to remove the flap of skin, that's extra skin, and the skin doesn't have any more power to retract, so it doesn't go anywhere. It's already hanging, and the only way, and I've been basically saying, you know, you have to take. It's like a tailor. You have to look at it as a tailor. You know, you have to do custom alteration because you're wearing, like, say, double extra large skin on a large size body. So what you're going to do with all this extra skin?
Gotta
You have
cut
to
it off.
trim it. And that's what's a tummy tuck.
We do have something in between that's a little less invasive. We do J plasma as well. And so if you
What's
don't
that?
actually need the full skin cut, say you just might have a little
Yeah,
bit of loose
there's
skin.
certain patients just have a little bit of a skin looseness, and certainly we use a J plasma during procedure for skin tightening, and that works many times a miracle because the skin become over course of a couple months after procedure really tightens up with that, and it's very easy tolerable because patients are already under anesthesia. It doesn't even hurt. They don't even know that I'm doing that procedure.
So look, this is what I want to know. How do you and like the other doctors in your practice, what am I trying to say? Deal with the patients that you have with unrealistic expectations?
That's a common problem for every practice. in the cosmetic world. First of all, we obviously have a massive explanation of exactly what the procedure will be
Pre-procedure.
Pre-procedure,
Okay.
how the procedure would be performed, and what the patient can have and cannot. Again, the procedure is tailored to the patient's needs from one perspective, but there is certain limitation to what we can do. So
Right.
we have, let's say, 3 kids, and the lower side is have a lot of stretch marks, and it's already hanging, which is normal. I mean, 70% of the women suffer that. We still can do liposuction and BBL, but we tell the patient, obviously, hey, there is a lower part there that the skin is not really anymore retracting. We have to follow that and do at least a mini tummy tuck or full tummy tuck later on to complete the image.
And then I was looking online also, like, isn't there like a certain amount or a certain number of liters of fat that you can take out?
Well, yeah,
or some shit like that?
I mean, Georgia law is a 4 liters of pure fat.
Okay.
And it's a large amount, let me tell you. This is a large amount of fat. I mean, in New York, it's like 5 liters. In Georgia, it's 4 liters. But this is a large amount can be taken during one procedure. If we're going to show all these buckets of fat, you will be amazed how much it is. And you don't measure fat by liters. Liters means not weight. Liters mean volume, meaning it's what it takes as a size-wise on a body, not what's on a weight scale. So you don't treat it as 4 liters or 4 kilograms or 8 pounds of fat. Don't look at it that way. It's this amount of fat is very lightweight, but it occupies a lot of volume. So the body image is really a volume problem, not really a weight of it.
And then I know, like, because before we interview you guys, I've been like doing some of my own little research online. It's a lot of people that, going back to the unrealistic expectations, that want to get everything done at one time. So how do you deal with the people that want to get everything done at one time, but that don't understand, like, they could really hurt themselves by doing that?
And that's what our role is to give them a full explanation so they understand. We're there to care for them,
Right.
not just to come and be a chop shop and do the procedure, whatever they desire. We also have to make sure that if the patient doesn't understand, that the procedure is on the safety level and also comfortable to the patient.
Right.
So the huge mommy makeovers that have been done over 6-7 hours under general anesthesia, you have to understand the longer the anesthesia, and general anesthesia specifically, the more complication, chance of complication after procedure. So maybe there is only one word here: convenience. There is nothing else. So
Right.
you try to make it elective, regular procedure safe, not just like come and do everything at one time. You don't need to do that.
Right.
So we try to explain that to the patient. Oh, many times patients appreciate that.
What makes a procedure risky?
Well, the procedure risky, like in every surgical world, doesn't matter. It's a technique. It's a person have to know and be comfortable doing the procedure. If we're talking about surgery.
No, I'm saying like what makes it risky from like a
A
patient, like
surgical point
Oh,
of view.
obviously, if you have cardiac conditions or you have seizure disorder, epilepsy.
Or like blood clots or
Yeah,
something
blood
like
clots.
that.
I mean, we choose not to perform those procedures. There's certain people of them can be still maybe done somewhere in the hospital, but it's risky for them. And we give them full explanation why we're not doing this procedure.
Yeah.
Because technically, there is nothing more precious than your life.
Right.
And you don't want to risk your life for a butt, right? So I would
will.
say so.
They will, right?
Yeah.
In pre procedures or post procedures, do y'all also like tell people that they should do other shit, like you should work out to keep this up
Or
and
change your diet.
change
or,
your diet? Because
It's exactly it's a little bit different because we post procedures they have to actually maintain their weight or sometimes even to gain 5-6 pounds up. Remember, we're doing BBLs and it's made out of fat. So the areas that we transfer, we don't want to lose that fat. We don't want to diet it. And that's exactly what a flex
I never
scalp.
thought about it like that.
Flex
Feed
scalp
the
is
fat.
designed. Flex scalp is a cheating procedure. We do your diet for you. I'm basically going in a 2 hours, take all this fat for the body. That's what you want to diet for. So we're already going to improve your body, but we're also adding the fat to the buttocks. And that fat have to be sustained and stay there. So you have to actually gain. Those areas that we did on your body and remove those 80-90% of fat will not really come back. Because if it stay within your weight 10-15 pounds plus minus, this procedure result will stay. It will not go anywhere.
Okay, so my next question is, if I was thinking about like becoming a mom or thinking about getting pregnant or whatever, in your opinion, would you suggest surgery before the pregnancy or after?
Well, definitely after, because especially if you're already coming and you planning to have a baby, obviously you're not coming to the plastic world before
Right.
that. So we have to wait until the childbirth, and we usually advise 6 months after childbirth
To give your
that
body a
we
chance to
can
settle back
examine you
down.
first.
Right.
We want your uterus to go back to where it belongs. We want your belly to retract, and we'll see the collateral damage that the pregnancy brought. You
So
know?
what you do as a person who ain't got no fat to transfer, but they want to ask, what you do?
Well, we basically don't do the procedure.
No, I'm saying is, what you got to put some fake shit in there?
No, we can't. Nobody can in the United States. It's illegal. There is no, and many people do suffer from that. And we've been forced to remove and suction their buttocks and suction those materials out of the butts, because technically speaking, this is a foreign substance that gets injected, and many times it's injected in some basements or some houses, and this is not supposed to be done. Okay, in this country it's illegal, so obviously we're not doing it. This is, and it can be major complications for the patients.
We do perform skinny BBLs though.
Yeah,
And
that's what I'm saying,
Yeah,
like-
and so the smaller the patient, that's going to be small results because you're
I
tiny.
mean, there are
but
other
you take the
substances
love
that we
handles.
can also give to the patients for easy improvement from previous BBL, or people who doesn't really have fat. We can do sculpture for them. We do spider butt lift. We have other procedures in a raise there to to do.
Give a little volume.
So with sculpture, you ain't got to add nothing. You just take
And
it
we
and got
advise
to
them
make
to
what it is.
And we advise them to gain some weight too.
Oh, so if somebody coming out too skinny, you be like, just eat for a couple of months and come back.
Yeah, and we even tell them what's the diet supposed to be, what the calorie intake supposed to be, what they have to do, and we even tell them to have to be re-examined 2-3 months once you gain certain amount of weight and see, because it's supposed to be certain amount of fat that makes feasible to do the procedure. We don't lie to patients. I mean, I usually tell the patient, listen, there is no fat right now in your body to transfer, but I can help you and guide you how to do this. You can go home. We're gonna stay together. You're gonna gain some weight. Come, we're gonna look at it, and the first sign that I can do the procedure and make it, we're gonna make it.
Now, I got a real question, man. How did you develop the stomach for it? Because a lot of people can't look at a lot of this shit. Like it's
just naturally being a doctor, a physician. I
Okay,
mean, we
so
get used to this.
Did it start like it didn't start like that though? Like you had to develop the
Oh,
stomach
it's
Like a resistance to that, or like, were you just naturally like?
for us. It's a profession.
right.
And this is basically a professional level procedures. It's
Got
just,
you.
For us, the surgery is just for architect doing architecture, for engineering. We're just doing surgeries. So we're not even thinking about it. It's absolutely normal. We're thinking about the quality of the procedure, what we have to cover, how we do it, comfort of the patients. That's what we're thinking about. But not the blood or feeling disgusted by that. No, of course not.
So look, I have another question. I'm
It's
sorry.
a human tissue. You have to respect it.
Right, for sure.
Like, I'm sorry about all the questions or whatever, but it's just a lot of shit I want to know about this. So I know that we were talking about, like, earlier previously, like, the male BBLs and stuff like that. But do you guys have any procedures that you perform on, like, transgender people?
Absolutely. And again, we're going back that everybody is different. Oh, now ethnicity or sex is all different.
Right.
So for, let's say, male procedure is supposed to be tailored for particular buttock shape. It's not supposed to be overdone. There's certain body image that says this is a male and this is a female, and we have to go with that.
Right.
Okay. For transgenders, obviously we go with what's desired by the patient. The patient have to tell me what the patient want, and we have to deliver that result.
Okay.
Okay. I don't usually.
Are there any, like, specific procedures, like, outside of the BBLs or anything that would be, I guess, customary for a transgender person to get to make them look more like the opposite sex,
Oh,
maybe?
certainly. There is a breast implant for them. I mean, we're not talking about sex reassignment surgery here because.
But how do you
cosmetic
give, like, a man or a person that wants to be a woman, like, that has, like, just a flat chest with, like, flat skin? How do you give
Well,
them,
you can do the fat
like,
transfer to the chest too. You can add a fat in their area. Again, breast is made out of fat. Okay. And
So you can really just basically take the butt off and like make
yeah,
the
and you
boobs?
can do several
Take the
procedures
stomach,
to enhance
make
it,
the boob.
and piece by piece
Oh.
transfer it there. Yes, and you can increase the breast size.
Oh wow,
Absolutely.
that's
And
really
later on, once
interesting.
you can build the breast size, you can even put a smaller implants to create a real, appearance of the breast.
Oh,
What the hell?
And it's all can be done. And it's all can be done under local anesthesia with no
okay,
problems.
okay, cool.
Mm.
That's crazy. It's I never knew that. I always used to. I've seen like transgender people that have guys that have gotten like breasts that kind of look really good, but I've always wondered like how that flat skin is able to stretch out and like make those things like that. Like
And we have one of our doctors who I did his procedure live. We did a live procedure, and
Did one on life.
yeah, well, he went live. We went live.
no,
with
not
one-
life. Not live. He said on live.
on
Oh,
live.
on live.
Yeah.
Oh, I was about to say.
Yeah.
That's
We
next
showed
level.
the doctor, and we showed that procedure for the doctor, and we were talking during procedure, and I was doing
Right.
his flanks liposuction.
So Bank had asked this question before we got on there. Like, again, repeat. How many procedures have you said you done?
Me personally, probably in excess of 7,000 procedures. At goals, we did probably over 25,000 procedures. And out
Yeah.
of that, BBLs and liposuctions, probably 24,000 procedures.
So about 97%.
97%, yeah.
Damn.
So, yeah, we've been a body specialist for years and BBL specialist for years.
So the BBLs when it started out, y'all would have been kind of slow. And the BBL got shit popping, huh?
BBLs, yes. Well, it's popping. Exactly.
Yeah.
That's it. And we make it popping.
No, real shit.
Yes.
I seen some of your work though, cause I check your page out. You fine, bro.
Yeah, and we try not to. Everybody's also different. Everybody's looking at it that doesn't have a personality. It does have a lot of personality. So the body image on every person is a little bit different.
Right.
And that's what also gets tailored to the patient. I mean, if you are 6 foot tall, you cannot have a butt that very low. So we try to rise it. In a contrast to the patient who has a very short stature, we have to position the butt correctly
We just said this.
and actually increase the size of the body. I mean, how tall she is, because we actually can fix that, because by putting the butt a little bit lower, you're gonna add a couple of inches to your height.
Yeah, we just said that. You can't take a Toyota Corolla frame and stretch it out and make it a Chevy Tahoe. And you can't take the Chevy Tahoe frame and shave it down and make it a Toyota Corolla.
Yeah, don't ask for a Tahoe.
If you so y'all are helping people achieve their body goals, but as a company, as a collective, what are some of y'all goals? Like, where are y'all trying to take it?
Well, that's where we want to take it. Right now, the company is all across the Eastern Seaboard. We have our presence in New York as a start. We came to Atlanta and been extremely happy about it, and we love
You're about to
Atlanta.
open another flagship clinic
Yes,
downtown,
we're going
right?
to try to open another flagship clinic coming in a couple of months, and stay tuned. It's going to be there soon. We're opening in DMV one clinic probably in a month. It's going to be already operational in Maryland and Washington, D.C., and Miami is hot and coming right now.
Oh, wow.
So who y'all direct competitor? You ain't gotta tell me on air. You tell me out there. I ask you.
That's confidential.
Yeah, that's what I asked
My
you.
direct competitor is my wife. That's my direct competitor.
Is your wife?
Yeah.
Why she don't want to get on camera? Why she don't like to get camera?
We'll stay confidential.
That's my girl. She's running shit.
Yes.
She's running shit in the background, yeah.
So what are y'all doing? Some fun shit, like just culturally, like do y'all listen to hip hop and rap and shit, or do y'all what do y'all do to tell us a little bit what y'all do to kick it? Where
While
y'all
doing
party?
the procedure, I mostly listen to the hip hop because that's what the patient desires.
They want to hear,
Right.
right?
These procedures.
They want to hear some little baby,
Yeah.
What artist? What
Or
artist?
some Pooh Shiesty.
some food
I'm
size
not
body,
really into the
body
hip
getting
hop,
cut off.
Right.
But me myself, I would listen to the reggae or something like that. I just like that thing, and it actually helps the procedure, and it's kind of going there,
Keeps it
with
upbeat
the
and
moves.
raw.
It keeps
Right.
upbeat with the procedure. But we ask patients what they want to hear, so I follow the patient wishes.
Oh, you ain't even paying no attention to it. You focus on your job.
Oh, well, of course we focus on job, but again, during our procedures, the patient is awake. And we're not just focusing on the job and doing our technical procedure. There is awake and alive patient on the bed that talking to us. So we basically have maintaining the full communication with the patient, talking during procedure, any subjects, whatever the patient like to. We're trying to make it comfortable. We're not trying to make it you came here for surgery and we're going to do your surgery right now, so lay down on the table. We're not doing those things. So the patient invited to the room, we do a marking, we discuss the procedure right before the procedure. We put her in a bed, we started administering the anesthesia. It takes literally 10-15 minutes for anesthesia to work, and the patient just feel a little bit of pressure maybe during anesthesia. Nothing much. We leave patient with a nurse in the room, and 10-15 minutes later we're starting the procedure, and you feel mostly vibration during procedures. That's why what I'm saying all this, the patient is so comfortable, they listen to the music and they have time to talk to us. Many times they talk about their lives, they talk about the families and business and all kind of things. And it's quite interesting. You can maintain a bonding with the patient during the whole procedure.
Which one do they come ask for the most? Like
what's the most popular celebrity that inspires the looks that the different girls want?
Probably. Well, obviously everybody's saying Kardashian right now. Kardashian is one of them, and probably that's the mainstay there for that image. Cardi B been lately there too.
Jada.
Little Jada, yes.
Jada.
Yes.
Oh, they coming and saying they want their Jada.
Absolutely.
Well, no, they coming and saying,
Shout out to Jada.
I want this body.
They come show you the picture.
Yeah, they show the pictures. Oh, and that's another thing.
That girl Jada
the
Waiter.
patient shows the pictures of all kind of celebrities, all kind of Instagram pages, and it's our job actually to explain how the procedure for her body is going to be there and what we're going to do for her. And again, we're trying to improve self-image of that person. We're not trying to make a Cardi B out of somebody, and certainly not Kardashian out of somebody. It's going to be that person with a way improved body.
With a new and improved
Yeah,
image.
because if you already born with that little S, you really ain't going already in the right direction.
you don't want a plastic surgery of the face that you need to change a passport after, right? You want a plastic surgery that still keep you as you, with a much better perception, much better image of it.
But what if you just built wrong? Like if your body just fucked up, what you do? I'm just being 100. If your body just
real.
fucked up, like
Then sorry.
Sorry.
We still have to approach the patient, and we still explain what we can do. Obviously, still try to do the procedure.
So you ever got my bad, Chris? You ever got somebody get up on the table like, man, this ain't what I asked for?
Oh, there are a lot of stories that we have, of course.
Give us one.
Sometimes the patient get out of the table. I cannot tolerate this. I didn't want to do that. And again, it's really sometimes we deal with people. It's a people business, But most in 99% of cases, this is very easy and tolerable procedure. But we deal with people. People are people. People being humans,
And shit happens.
Have you ever did a procedure and you looked at it like, I fucked that up?
No, not really. Not really. But I always been honest to the patient. There are certain areas sometimes, let's say in my vision, and I did a procedure and something can be changed there. I was changing it before. But the point is, our procedures already have such a strict protocol, and it's basically every doctor participating is doing exactly the same procedure.
Yeah.
And exactly in the same protocol of the flex scalp.
So let me ask you this. Okay, I asked you about the patients that have unrealistic expectations, but how do you deal with patients post-op that complain about their results, but they didn't do what was needed to maintain themselves after surgery that basically made them not look how they wanted to look?
Well, you certainly have to take time explaining that. You're bringing before and after pictures and showing what she looked before. We weigh the patient. If you stay within your weight, plus minus 2-3 pounds, there will be absolutely no changes. But if you gain 20-30 pounds after procedure in the liposuction area, yeah, that's a significant amount. And it might change not just that area, but the areas that you didn't do the liposuction. And it's actually will change the body image. So, but it's hard work. You have to sometimes deal with the unhappy patients and the patients who are unrealistic with their expectations, even though before we addresses all this, we still have to approach. Our job is nicely approach the patient and explain him all these pros and cons. Many times the patient have to go for around 2 for the procedure. later on, if they gain tons of weight and they really change, well, we need to do a second round sometimes. And many patients sometimes benefit of a second round because you can collect more fat and actually add on to the butt. Why not?
Follow-up is very important. So I tell the
Follow-ups are very-
patients that we do half the procedure for you today, but the second half is going to be how you maintain it when you get home. So we have certain instructions. You don't put any pressure on your butt or hips. Your diet, clearly. We have lymphatic drainages, massages, as well as the faja. So the
And it's a
combination of all
requirement.
these
And
things
it's a
together.
requirement that goes.
Yep, it gives you
Okay,
your
so let me-
maximum results.
Let me ask you this about the lymphatic drainages, right? So the lymphatic drainage, from my understanding and from my YouTube tutorial, is when after surgery, like the fluids and stuff are draining out. But the fluids that are draining out are actually the fluids that were put in to kind of help numb what was going on, right?
Yeah, so I think we have a combination of two things. So we have our local anesthesia, which is what gets the patient numb. And so we fill the patient up with this local. But there has to be somewhere for this local to go post-operatively. So after the procedure, a lot of it comes out during the procedure, during the liposuction, but there is going to be a lot that's still remaining after, and then as well as just your normal body
Them
processes.
tubes, that be them tubes
Yeah,
sticking
that's
out.
a
right?
draining,
we don't have
so
no
we keep
tubes
patients
in the body.
open.
We don't have nothing.
Yeah.
There's no tubes. We don't even stitch those incisions during local. We don't even need to stitch them because we need them actually open to drain. We won't remove that liquid.
That's
We're
why
gonna
those
close-
drain tubes that they
No,
be
we don't
They
put
don't
the
use-
drain.
Because that's
we
for
don't
tummy
use
tucks
it.
and those and
That's
the
for
bigger
tummy
procedures.
tucks.
So for the liposuction
And
with BBL, we
to clarify,
Oh, okay.
to qualify that, we put a liquid or anesthesia in the body, which is basically gone within 24, 48 hours of the body. Later on, because of the surgery was performed in that area, the body produced edema, swelling. That's what natural thing is.
How long does it take for the swelling to completely go down?
About, I would say, from 3 to 6 months, it will be completely out. But your
months?
body,
Yeah.
3 to 6 months, this liquid, because it's a healing process.
Yeah.
So you have to be a little bit patient with the healing process. But cosmetic-wise, you will see tremendous results, kind of even on looking as a final about 2-3 months. But the body, even beyond that, will be continuing healing. And what's needed is the skin will retract because it's not just the liquid goes away. The skin will accept new position and new desired shape with the help of faja and compression garment. All this necessary to sculpt the body, and that's what we do. We do body sculpting.
That's big.
So what's the like when y'all saying sculpturing, right? What's that procedure like? How long is it?
Oh, it's about 2-hour procedure, more or less. Depending on the patient's amount of fat, situation, height, weight.
What that come with? What that is like? Lipo, a lot of lipo.
The patient will see how the fat is basically leaving their
I'm
body.
saying like, what's the sculpturing procedure like?
The sculpture procedure, well, it starts with a marking process, which is also unique, and we develop certain marking and positioning of the holes. So, and the markings is different from individual to individual, that's what we're doing for sculpting.
Okay.
So to sculpt the body, yes, we have to perform the same procedure technically, but again, we're going back to the same question. Everybody is different, so we have to sculpt the body according to what this particular body needs. And sculpting means, again, creating all this curve and positioning and knowing the anatomy of the patient and positioning in desired shape.
Can you get a sculpture without doing the BBL?
You can do it just a liposuction and do the liposculpture.
Yeah, that's what I was asking.
Yeah, so you can just sculpt the body. BBL is an addition of fat as the patient desires. If the patient desires that we want a bigger butt or restore my butt volume, that's what BBL designed for.
If you want to just come take it out and sculpture your shit.
flex sculpt and liposuction part is basically to remove the fat from undesired areas and to sculpt those areas even without the BBL.
Okay.
Okay. Cool.
Any questions?
What we doing,
Very
Scream?
informative. Very informative. I learned a lot. I'm sure the
I
people
feel like
have
I'm
learned a
doing
lot.
consultation right now.
Yeah, yeah.
Now we want to get in your business, man. We want to know what your life is, what you do when you're not doing procedures.
I'm doing BBLs. No.
So
When
let
you're
me
not
ask you
doing
this,
procedures,
because this
what
is
you doing?
something that I ask everybody that comes here or whatever. Like, as far as like a bucket list, what's on your bucket list? And I want you to like just kind of talk about a little bit, like somewhere that you want to travel that you've never been, something that like outlandish that you want to eat that you've never eaten, like anything
It's
like
very
that.
hard to
like,
make a reservation in Atlanta, honestly saying.
Huh? Say what?
Dinner
It's hard to
reservations.
make a dinner reservation in Atlanta.
You need more restaurants here. So, but yes, I love cooking, and that was my passion.
What do you cook?
Mostly, I mean, we're coming from Russia. I'm born in Russia in the southern part in Azerbaijan, which is basically like a Turkish cuisine, Middle Eastern cuisine. And
Okay.
That's what I've been my passion. If I wouldn't be a plastic surgeon, or
Do you have a
surgeon
favorite wine?
here, I would probably go and go be cooking all day long.
You got a favorite wine?
Favorite wine, probably from red wines is Malbec, Sauvignon Blanc from mostly New Zealand Sauvignon Blanc.
High five, guys.
Yeah.
Yeah. Okay. And what about
But I
somewhere
love
that
old
you-
fashioned, so I'm in the right place here in Atlanta.
Yes, yes. And what about a place that you've never been that you want to go?
For me personally, my dream was to go to Amazon River.
Oh.
That was my personal dream was always.
So do you like wildlife and rainforest and stuff like that?
No, it's just a childhood dream, and
Okay.
I just wanted to see it, and we've been traveling all over the world, and I love traveling. We've been everywhere in Europe and France and Germany and everywhere. I mean, you name it.
Okay.
But that's what my goal probably since traveling.
I can dig that.
So my final question is: would either of you two get a procedure, and if y'all would get some type of procedure, who would
What
y'all
would it
trust
be?
to do the procedure? Obviously, you would say.
Dr. V only.
Okay.
And I
for
would
you.
say Nicole. No,
Yeah.
I'm sorry.
Have you ever gotten any procedures? Thought about procedures?
When the patient asks me sometimes, "Did you do that procedure to yourself?" I said, "What? I'm crazy." No,
Okay.
but I'm joking, of course. I mean, I would trust all my doctors to do the procedure. Again, we developed a unique protocol, and that protocol is enforced on a daily basis. Every doctor gets a quality control and check. All our doctors doing literally the same type of procedure with the same vision, and it's a goals vision.
To the gold standard, always, all the doctors. Yeah. So we can, you might be assigned Dr. ATL because all of our doctors are going to do it to Dr. Voskin's standard. He's trained all of them individually. And so the same technique is used by all the doctors.
Okay.
Okay. That's what it is. I hope a lot of people got a lot of
I know I did. I just learned a
information
lot.
from this.
I
I,
just learned
definitely
a lot.
learned a lot of shit.
I did too.
In this, you know what I'm saying? A lot of good shit.
What about you, Bang? What you
especially
learned?
this guy.
I'm trying to see what these folks got going on outside.
I bet
These
he's
folks
going.
move like
I bet he's going to have a consultation. We're just not going to go live.
Yeah. We're gonna do that off the record, like.
Because he has so many questions about BBL. I know where he's going.
Yeah.
no BBLs.
No names. No names.
Man,
No names,
come
yeah.
out here.
Yeah.
Right.
Folks moving like some mobsters, man. I'm trying to see what's going on with that other thing. But we'll come back to that, man.
Yeah.
Right, what did it say?
Thank you guys having me.
Part two.
Thank you. I appreciate
And
it.
big shouts out to
So very
Goals
welcome. It
Plastic
was our
Surgery
pleasure.
for blessing us with their time.
Dr.
You know what I'm
V,
saying?
Nicole, everybody.
I
Absolutely.
appreciate it.
Y'all
Thanks,
tap in
y'all.
if y'all need that work. www.bigfaxpod.com. Salute.
What's up? This Jade. We just pulled up to Goals Plastic Surgery. We're about to go inside and take a tour of the building, see the ins and outs, how everything works there. And we're gonna actually look at one of their patients getting a brand new body.
How are you? Nice
Wonderful.
To see you.
This is
Welcome to
Nicole.
Goals.
She's gonna be taking us around.
Yeah.
Hey, Dr. V, how are you? What you got to show us, Dr. V?
Oh, we can go to the surgical room. We can discuss the procedure. We're going to show.
Are we gonna see you like drawing the little marks on the lady or whatever?
We can do the mark.
Okay, let's get it.
Dr. V, how many booties you did today?
Today, none.
No booties yet?
Nobody today.
Okay.
But our surgeons did probably already like 4 or 5. Hello.
Hi.
What is the purpose today? But
360 hips and butt.
all these have to be removed. And I'm going to explain to the patient. Even this situation here I don't like. That's why procedure is tailored to each body. Because this is sticking out and I don't like it. It has to go.
Okay.
That's the area where the light touching will finish. Now the muscle, this muscle is too thick, that muscle is right here, which is basically outlined out. And a little bit this fashion. Because they go in this direction.
Okay.
Okay. Now we have a belly. This is a belly-like section, which probably would include also all of this because this needs to go. liposuction 360. So we have to remove all this fat from there. She's still gonna have a residual fold of empty skin. I have enough to do it. It's a little bit too much skin that I don't. I go along the spine line and make it again symmetry. See, all these unwanted pieces of fat together with sliding skin we have to remove. Those are the dimples that right there. We have to include them. Same thing, we're gonna go here and it's patient and connect all the dots from the front to the back to improve the body area's appearance. In her case, mostly obviously the clothes. All this territory have to be returned back, the fat, as well as the butt. And the fat will be transferred in multiple directions under to evenly raise up like a dough here. That's basically it.
Okay.
They have great
As long as
results.
we're okay?
I'm so excited for you.
All right.
I'm excited. Yes, I'm excited for you. Awesome. Okay.
What like brought you to this point to make you want to do like the transformation surgery?
I mean, I just lost a lot of weight and I just want to look like
You wanna, like, feel back like yourself,
Yeah, feel
like-
sexy again.
Okay, and you said you have 3 kids?
I do.
What kind of kids do you have?
I have 2 boys and a girl.
Did you tell them like that you're about to do this or whatever?
I did.
And how do they feel about it?
Well, my daughter is excited. She's like, she gonna call me at lunch because she want to be the first one to see it.
But like how do the boys feel? The boys are kind of like
They like iffy. They let just go with the flow.
yeah, because I have 2 male like my guy co-hosts or whatever on the show. We left them at home today because they don't understand this part of like the whole situation or whatever. So I just brought Cash and Shy and the girls, and basically Dr. V is like taking us through like the whole process of like from start to finish, how he does his patients, how he preps you guys, gets you guys ready. He showed us the facility and he showed us like the kind of like after thing or whatever. And it's like we did an interview with him and he kind of like explained everything and broke everything down about each process and stuff like that. And I really learned a lot once he explained it and broke it down and gave us the process about like the local anesthesia and how you're still like alert and it's not like you're out cold and then you wake up and you don't know what the fuck happened. Like that really just kind of made me look at everything in a different light. So I'm glad that I was able to meet you and able to like sit in on your process and stuff like that because I learned even more today like about how everything is supposed to go or whatever. So that was dope. And I hope everything goes really well for you and you get back to like how you want to be and everything like that. And it was really nice meeting you.
Thank you. Nice meeting you.
Okay.
I appreciate it.
See you later, sweetheart.
Alrighty.